Alright, so like I explained, the cheese reaction is a sudden rise in blood pressure on eating cheese or anything that contains tyramine. So the reason why we say cheese reaction is because this cheese we are seeing here, this cheese contains tyramine. That's what it contains, tyramine. And when the patient consumes the cheese, there will be a sudden rise in blood pressure, especially when the patient is on what? Monoamine oxidase inhibitor. So cheese reaction is a sudden rise in blood pressure in patients taking cheese alongside they being on monoamine oxidase inhibitor drug. You get? Okay. Now, apart from cheese, which other thing also contain this tyramine? Because tyramine is a culprit here. Apart from cheese, which other thing also contain tyramine? Apart from cheese, we have red wine. Red wine contains tyramine. So red wine contains tyramine. Sausage contains tyramine. So those of you taking sausage, we also have some vegetables also contain tyramine. For example, fava beans. Fava beans contain tyramine. I get my point. There are many other things, even liver too. That is animal liver contains tyramine. Then aged meat, all those meat that has been left for long, like before you bought it in the market, has been there. So it also contains tyramine. Now, the kind of cheese that contain tyramine, to be specific, are fermented cheese. Not all cheese contain tyramine. For example, your cream cheese does not contain tyramine. Fresh yogurt does not contain tyramine. Cottage cheese does not contain tyramine. The kind of cheese that contain tyramine are fermented cheese. Fermented cheese. Are you there? All right. So that is for that. So imagine you are about to treat your patient for depression and you are saying, oh, don't eat this, don't eat that, don't eat. The patient will even die of fear because you are giving the patient that, oh, if you take this drug alongside with this food, so you're telling the patient that don't take red wine, don't take sausage, don't take fava beans. Please don't mind the noise in the background. Don't take these things. So the patient will even die from fear than the what is it called now? The depression itself. You get what I'm trying to say, Nabi? So that is why their use is usually limited. Now, apart from the cheese reaction, which is a drug food reaction, we also have what we call drug interaction. Drug interaction from use of MAO inhibitors. Now, there are two problems you can get. Like I explained, you can have what we call hypertensive crisis. Now, this is a condition whereby you are taking MAO inhibitor alongside with other drugs that can increase the level of norepinephrine. I get my point. All those other sympathomimetic medication. For example, if you give a patient alpha-1 agonist, alpha-1 agonist medication, for example, those ones that are for cold medication. Those ones are usually available over the counter. For example, drugs like xylometazoline and oxymetazoline. So these are nasal decongestant. Both of them are nasal decongestant. I get my point. They are both nasal decongestant that patient can easily take over the counter. And when the patient take this kind of medication, they are also on MAO inhibitors, they can come down with hypertensive crisis. Okay, because now you are now favoring what we call this alpha-1 agonist activity, which is on your blood vessels. I get my point. So, and by virtue of taking MAO inhibitors, you already increase the levels of norepinephrine. Are you there with me? Norepinephrine are already high in the circulation by virtue of MAO inhibitors, and now you are now on another alpha 1 agonist like xylometazoline, oxymetazoline. They will also therefore cause more hypertensive crisis. So that is for that. Now, apart from alpha 1 agonist, if the patient also combine TCA plus MAO inhibitor, again, same thing will happen. By virtue of MAO inhibitors, your levels of norepinephrine are already increased. Now you are not taking TCA. TCA will increase both norepinephrine alongside with serotonin. So I get my point. So norepinephrine, synergistic effect we see. So again, hypertension, hypertensive crisis. Are you there with me? Alright, this same TCA can also, since it's increasing serotonin, can also therefore cause serotonin syndrome also, because this your MAO inhibitors, apart from increasing norepinephrine, also increase serotonin too. So serotonin plus serotonin will give you serotonin syndrome. So that is for that, for your hypertensive crisis. Also, if the patient is taking things like amphetamines, you know amphetamines now, amphetamines and ephedrine, these medications also, they increase the levels of norepinephrine. So if you are taking them alongside with MAO inhibitors, you will come down with hypertensive crisis. Okay, so that is for that. Now let's now move to the other side effect of serotonin syndrome. There's something I forgot to explain in the last video. I will explain it here. That is, how does tyramine work that is not causing that Shears reaction, which is the sudden rise in blood pressure. You get what tyramine does is that, let me just put it here before I enter the serotonin syndrome. What tyramine does is that it displaces norepinephrine from the vesicles. So if you give a person tyramine is an exogenous monoamine, so it will displace norepinephrine from the circulation. Therefore, norepinephrine levels will be increased. And you know this patient is not taking, is on a MAO inhibitor, so it cannot destroy norepinephrine, which a normal patient would have done. You get? So by so doing, norepinephrine levels will increase. Then you see the hypertension for the Shears reaction we discussed about. I forgot to explain the mechanism behind it. Okay, I'll just explain it now. I said if the patient is taking tyramine will displace norepinephrine from the nerve ending. We will have increased norepinephrine. The patient is on a monoamine oxidase inhibitor, since you are treating depression, so you cannot destroy monoamine. High levels of norepinephrine will cause hypertension. That is the Shears reaction. So back to serotonin syndrome. So serotonin syndrome is another drug-drug interaction you can get by virtue of combining monoamine oxidase inhibitor with other medications. For example, now this is usually due to high levels of serotonin. I get my point. So if you combine MAO inhibitor plus SSRI, again we come down with serotonin syndrome. MAO inhibitors already have increased levels of serotonin because they are usually non-selective. Okay, then especially that first class, which are the non-selective MAO inhibitors. Then SSRI again already increased the levels of serotonin, so you have a synergistic effect. So you come down with serotonin syndrome, which I will explain later on when we will talk about SSRI particularly. You get? So that is for that. Then also, if you combine MAO inhibitor, again MAO inhibitor plus tricyclic antidepressant, the same thing will also occur. Again, if you combine them with triptans, MAO inhibitors plus triptans. Triptans are medication that are used to treat migraine. What they do is that they increase their activity on, like they act on certain serotonin receptor like 5-HT1B 1D receptor present in the CNS, and by so doing they can cause vasoconstriction. Okay, that's how triptans work. So they have this, they stimulate the receptors, to be specific. They stimulate the receptors. So now when you are increasing the levels of serotonin by virtue of your MAO inhibitor, and you now combine them with triptans, again you are more risk of serotonin syndrome, which we will also discuss later on. So that is for that. Just to reiterate, triptans are anti-migraine drugs that are used to treat migraine. Okay, what they do is that they act on 5-HT1B 1D receptor present in the CNS, and by so doing they are able to cause vasoconstriction. Migraine is due to vasodilation of blood vessels in your brain. So when you now cause the vasoconstriction, you treat migraine headache. So that is what triptans does. If you combine triptans with monoamine oxidase inhibitor, you are at more risk of serotonin syndrome. I will explain what serotonin syndrome is in the video on selective serotonin reuptake inhibitor. You get. So that is for that. Then again, if you combine MAO inhibitors plus St. John's wort, it will also come down with serotonin syndrome. So St. John's wort contains what we call hyperuricin. This hyperuricin again is acting like an SSRI. So again, it will increase serotonin levels. MAO inhibitors will also increase serotonin levels. So therefore, you come down with serotonin syndrome. Okay. So for now, that will be all for now on the adverse effect of taking MAO inhibitors. I said the adverse effects are basically the Schiz reaction, the adverse effect you get are two types. We have the drug-food interaction and a drug-drug interaction. For the drug-food interaction, that's where you have your Schiz reaction. Okay, while for drug-drug interaction, you have hypertensive crisis. I get my point, and serotonin syndrome. Although this hypertensive crisis is same thing as Schiz reaction, but that for Schiz reaction, it is not drug-food interaction. So that is for that. I hope you are following. So the second class of MAO inhibitor we talk about was your reversible. It's called RIMA actually. It's called the reversible inhibitors of MAO-A. I get my point. Reversibly inhibit MAO-A, and there are two drugs here. We have moclobemide and clogilin. Moclobemide and clogilin. This is G. Clogilin. These are the two drugs that are reversible inhibitors of MAO-A. The first class we've been discussing are irreversible inhibitors of both. You get why this one is reversible inhibitors of MAO-A. So their effects compared to the previous one, which lasts for days, this one their effect usually lasts just for 2 to 4 hours. So they will have less Schiz reaction. For these ones. Okay, and this particular RIMA set of drugs, they are more used for treating atypical depression. So they are used for treating atypical depression. That's where you see they are used in atypical depression. Okay, this video is taking time already. Trying to wrap it up. They are used for treating atypical depression. Atypical depression is usually characterized by excessive sleep, also excessive eating. In a normal depressed patient, you will not expect them to be sleeping. They will be having insomnia. But in atypical depression, there's excessive sleep, and also there is hyperphagia. Patient eats a lot compared to a normal depressed patient. So now, moclobemide and clogilin are your two drugs you use for treatment for atypical depression. Okay, so the last class of the MAO inhibitors is your selective MAO B inhibitor, and this one is what we call selegiline. So selegiline usually is available in skin patch, and that means it can bypass your first pass metabolism stuff, your GI and those ones. Okay, so the only problem is that it's more for Parkinson treatment. It's more for Parkinson treatment, not for depression. It's more for Parkinson treatment. Okay, and again, it shows no Shears reaction. You know, the Shears reaction is usually mediated is more mediated by MAO A and not MAO B. So this one is inhibiting MAO B, which is in the brain. You don't expect any Shears reaction to occur. Okay, so just to wrap it up, I have discussed three classes of MAO inhibitors, which the first class are the non-selective. The second class are the selective MAO A, and the third one are the selective MAO B. This one is reversible, right? Basically, why this one is usually irreversible? Is that not so? Irreversible. Now these ones are the ones that you see more of the Shears reaction, more of the drug-drug interaction, all those things. More of the Shears reaction, you see it more in this non-selective reaction. This one has less Shears reaction and are usually used for treatment of atypical depression, while this one does not have any Shears reaction. While for the drug-drug interaction, which is usually seen in general for all MAO inhibitor drug, they're usually seen in them. We said those drug-drug interaction are of two. We can have hypertensive crisis. I'm just repeating it up because it is very long. Hypertensive crisis, and we can have serotonin syndrome. Okay, please don't forget the medications we talk about. Okay, alright, so we'll stop here. In the next video, I might just again try to wrap up everything in one 5-minute video. Then we will now talk about tricyclic antidepressant. Again, I will give you guys the treatment for this Shears reaction in the next video also, the antidote for it. Alright, thank you.